This question is about when men say that physical touch is a need. I'm going to answer this based on my opinion only, from my experience in couples counseling, from my master's degree program and the training that I did there, and also through my own understanding of the different levels of consciousness. I think therapists who do this are operating from a 3D level of consciousness under the framework of the matrix. What does that mean? It means that the goal of couples counseling is to preserve the relationship rather than individual well-being. The therapist will tackle relationship issues at surface level understanding, exploring love languages or attachment styles, but fails to dig deeper into the real cause of our relationship issues: power dynamics, gender roles, subconscious programming. And I think this is why so many people walk away from couples therapy feeling unheard, because the system isn't built to help people break free from dysfunctional dynamics. It's built to keep relationships functioning within the system's conditioning. So within the 3D framework of relational experiencing, relationships are viewed as transactions. If you meet my needs, I'll meet your needs. We see this through the love languages. There's also an expectation of entitlement, especially around sex and physical affection. Emotional labor is placed on the woman, framing men's needs as primary and women's discomfort as something to work through rather than to validate. And this is why in therapy, when men say, I need physical touch to feel loved, the response is often, okay, what can we do to make that happen? Cue the love languages. Instead of, where does this belief come from? Is this truly a need, or is it a conditioned expectation? Is this need a core wound that hasn't been addressed? Fear of abandonment, lack of self-soothing skills? Is physical touch being used as a self-regulating tool rather than genuine intimacy? Does the other person have autonomy over how they express love, or is their affection being treated as an obligation? When we step into higher levels of awareness, we will see that love is alignment, not obligation. Emotional connection should be mutual, not transactional. Intimacy isn't about getting something from somebody else. It's about being in sync with another person. The issue isn't that physical touch isn't important. It can be to some people. The issue is how it's framed. If physical touch is being used as a demand or a condition of love rather than an organic expression of connection, then we're operating within our attachment wounds, and that's not true intimacy. So what can we do? We need to challenge the idea that love equals obligation. If your partner feels uncomfortable with physical touch, you need to ask why instead of guilting them and demanding. And we need to expand our definition of intimacy beyond the physical. Therapists who don't understand these deeper layers might unintentionally reinforce the old paradigm, one that reinforces compliance over connection. But if we want to move towards authentic, conscious relationships, then we need to break free from this transactional model and step into a space where love is freely given instead of taken. Let me know your thoughts.